Hi, folks, it's Ann. Welcome to my channel. I see that I have so many new subscribers today following that video I put out on Wednesday. Now, for those of you that don't know or that haven't seen the video, it was about when I went for a physical and blood work to a clinic, and the nurse practitioner started yelling at me, so I walked out. Now, I've been reading every single one of those comments, and it breaks my heart to know that it's happening to so many people. And I suspected that it did because, we're getting older and people just don't treat us the same as they once did. But it sounds like it happens quite often, and it's just a shame. So I want to go over that. Now, if you look at my last video, it was 2 days ago. You could find the whole story. I don't want to go through the whole story again, but I want to do a follow up on that. And I want to discuss some of the things that I might have done differently. So let's pick up at the part where I walked out of her office. I didn't holler. I didn't correct her, I didn't say anything to her. I just walked out. And I also, like I said, did not follow up with the investigator. I just let it slide with the suspicion that they were going to charge me for a visit that I didn't have. Now, my mentality back at the time was I wasn't feeling good. I didn't have the strength to get into a big issue like that. I didn't want to deal with it. And also because I was on this diet that I started the day after that incident with her. That incident was March 21st. On March 22nd, I started my journey and reducing my carbs and trying to get my blood sugar down. And I know having blood work done is critical when you're a diabetic. So now here we are in December and I still haven't had blood work done. But I wasn't pushing it. Another reason I didn't push it was because I actually wanted to go a little while before getting my blood work done. After I started my journey on losing weight, I wanted to go a little while because when I did get my blood work done, I wanted it to show that my numbers went down. And since then, I've lost 25 pounds. And I'm almost certain my numbers have gone down. So I'm ready for some blood work. But I know I have to wait. But the thing is, I don't think I handled that right by walking out the door. I should have tried to smooth it out a little bit. I might have said something to her like, I don't feel like you're talking to me decently and I feel a little disrespected. I could have said something like that and seen how she responded, because I'm the one that's suffering now. And no, that doesn't mean putting up with what she was doing, because it would have all depended on her response after I said something like that to her. And here's another part where I dropped the ball. The investigator sent me a letter saying that they said that the exam was complete, and I just filed it away. Like I said, I didn't want to deal with it. I didn't even want to think about it. It just upset me so much. I didn't want to deal with it. So it went into my filing drawer. And when I was talking to Medicare the other day to try to straighten it all out, they said that they sent me a statement in August. And I thought back, and I think I did get that statement, and I think it did show a small amount taken out. So I thought everything was okay, but I didn't really look into it too much. That might have just been for one little part of it. So I didn't put my mind to it, folks. I didn't follow up the way that I should have. I should have kept right on it. I shouldn't have let months pass. Now, I'm not giving them a break because what she did was totally wrong. And I'm sure now she has heard that I I reported it and investigated it. So maybe she's making some changes with the way she deals with people. Because I heard she treats a lot of people like that. I think it's just her nature. But I should have really kept at it and made sure everything was straightened out. I mean, this is my medical reports and my coverage and everything. It's so important, especially with the problems that I have. But once I got on this diet and I started feeling good, and I got my carbs out of my system, and I know my sugar was going down, it was showing that it was going down, and I felt like I was getting stronger. My mindset was like, I'm gonna do this on my own. I'm gonna try to do as much as I can on my own. And that's how I've been feeling all these months, because each day I feel a little bit better. But I think I still should make sure my records and everything is kept up, and that I can get coverage when I need it. Because I have like three different types of coverage. I have the New York State Empire coverage, and I'm blessed with this. I realize how blessed I am with this. But I have that, I have Medicare, and I also have VA. So I'm fortunate in that regard, but none of it's going to do me any good if I don't keep up with it and make sure that, you know, it's handled properly. But I'm telling you this because part of this issue was my fault. I could have had this solved a long time ago had I followed up and done the right thing. But the part with the disrespect, that's pretty hard to forgive that, because like my comments are showing, so many of us are dealing with this kind of thing. And there has to be a way that we could make this better, and not put up with it, and still be able to get our health care the way that we should be. And so I've looked into some things, and there are some things I want to share with you about this. So one thing that one of my subscribers commented about was that it would be good to record the doctor visits, and I agree with that wholeheartedly. And the only thing with that is some states do not allow it, while others do. But even if I had gone in there and told her, would you mind, or asked her, would you mind if I record this, as long as it's legal, she wouldn't have been acting like that. That would have nipped it in the bud before she even started if she thought she was being recorded. And another good thing about recording, and we have our phone, it's so easy to do. And if you don't know how to use the recorder, just make a video and all of it will be recorded. But I think that's a wonderful idea. And another good thing about it is that if you're like me, sometimes they just ramble off the diagnosis and everything, and it's so hard to understand and to remember. I mean, if they're telling you 10 different things, um, you get home and you think, what did they just say? That's the way I am. So having a recording, I mean, that could help you in so many ways. So, but you do have to make sure that it's legal in your state and you're allowed to do it. But I will definitely be considering that, with all of my doctor's appointments, because I do believe I could have it done, and I could do that in New York State. But in the way that I'm going to handle it, I'm just going to let them know when I walk in. This will prevent them from even thinking about being disrespectful. So I think it's a great idea. And thank you to the person that commented about that. So after looking into a few things, I did find some places that you can go for help. Of course, I'm doing the Medicare. I'm waiting for their appeal letter, and I'm going to follow that through and see what happens before I jump into something else and start fighting in a different way. But hopefully it'll all work out, and it'll be soon, and I won't have to wait too long. But the United States government, hold on, folks, has the Elder Care Locator. It's a helpline that helps seniors with legal aid, elder services. car agencies for aging, etc. And you could look them up and you will get the help that you need. You have the Patient Advocate Foundation. It helps patients, especially seniors or those, hold on, folks, with serious illnesses. It helps you navigate the health care system with the bills, helps you access records, appeal, denied claims. And who knows if I might not have to go that route if I don't get this corrected. But I love that all of you are right on board with me. If they say that I had all of this done, then where is my blood work report? Where are the results? So they don't have a case. They do not have a case, and I can't wait. And of course, I'll keep you informed, but I can't wait to see how this all plays out. You have the National Council on Aging, and they offer a bunch of programs and resources, health and financial security report. Let me see. No, I got lost there. Oh, I got lost, folks. I'm sorry. Hold on. Give me a minute. Okay, that was that. They can give you advice and give you the tools you need. Then you have the National Center on Elder Abuse. And this is abuse when you get spoken to like that. You shouldn't be treated like that. It provides information about elder abuse. Sorry, I'm just trying to resize this window and I'm getting lost here. And it includes any kind of disrespect or mistreatment in medical care. Now, you would think these doctors and nurses and medical staff would not want this against them on their record. So, even if you just threatened it, if they're being disrespectful and you can't handle it, even if you just said, you keep this up, I'm going to report you to the National Center on Elder Abuse. We could do it. They have to know that we're not going to tolerate it. We could do it. We can stand up for ourselves. And the next time that something like this happens to me, I'm going to handle it differently. I'm going to handle it. I'm going to handle it nice and calmly. And then I'm going to do the recording. And, well, I hope I don't have to threaten that. But, sometimes we just might have to. So we'll see. See. And then you have the area agencies on aging. Like here in New York, we have the Office of the Aging, and they've been wonderful. I used to deliver meals for them to some of the elderly, and they do a lot. They help the, I have to give New York State credit for that. They do help the elderly here. So I'm very thankful for having that Office of the Aging here. They give out meals and everything to those that can't afford it or for a very little charge. They have these buses that go around and pick up people that don't have a car or need to get transportation to doctor's appointments or out shopping. They come right to the door. And I'm thankful for all that because, yeah, I have a car now, but someday I might not. I might be in an apartment and need transportation like that. So they do. There's programs out there that really will help us, folks. And so we have to reach out to them if we need to. If we can't handle this alone, and it's hard to keep up on it. Like I said, it gets confusing and it's hard to keep up on it. Sometimes it would be very helpful to reach out to somebody that could help you. Sorry, folks, I had to cut the tail end of this video because my software program was giving me a problem once again. But anyway, I wanted to thank you all for being here, and I wanted to mention that we need to all stick together, folks. Most of us, we're the boomers. Well, all of us are the boomers, and we need to stick together and let it be known the mistreatment that we sometimes get. So I'll be here on Monday at 4 p.m. My schedule is Mondays, Wednesdays, and Fridays. I usually try to get a video out by 4 p.m. and I hope to see you all there. Take care. Be safe. Stay warm. Bye for now.